So he, like I mentioned, he made this one video, and I am talking about this with you because I wanted to know your opinion on it. I am again, like totally unbiased or undecided of, like what it is or whatever. But Ben Shapiro, is that his name?
Yes.
Okay. So he mentioned that trans people have this, again, mental illness, and they should not, it should not be like that, or, like kind of opposing the existence of trans thing. What are your, like views about this part?
About whether it's a mental illness or about how to deal with people who are anti-transgender.
Maybe let's talk both one by one.
Okay. Right. So the thing about calling it a mental illness was originally justified,
Mm-hmm.
at least where I'm from, by saying, well, transgender people are asking doctors for help. They're asking
Yeah.
for hormones and surgery often. So how is the doctor going to give any kind of treatment? Because that's what doctors do, they treat illnesses. How is a doctor going to prescribe hormones as a medication if the person doesn't have an illness to treat, right? How is a doctor
Interesting.
going to, a surgeon,
Yeah.
how is a surgeon going to operate on a healthy body part, doesn't have cancer, isn't causing pain, if the person doesn't have any sort of illness to treat?
My
Like, what is the
goodness.
motivation? So calling transgender identity a mental illness was justified by saying it helps the medical professionals, right?
Okay.
In like the 1950s, 1960s, 70s,
Oh,
80s, even 90s, it was uncommon for a psychotherapist or a medical doctor to work with a transgender person and to enable that person to change genders, right? To support them.
okay.
The
Oh,
medical professional was taking a risk, right? Because they have their community of professionals and they have to not be seen as doing something that is too controversial
yeah,
or
yeah,
that
yeah.
might be damaging someone, right? That's the argument. Like someone comes to you, a patient, a client comes to you and says, I'm transgender. Well, what if that person is psychotic, right? That's going to be the
Yeah,
argument the medical
yeah,
professional has. Then the medical professionals community, their peers and their supervisors are going to say to them, well, how do you know that that person doesn't have a psychosis? And like, you don't want
yeah,
to operate on that person if they have some totally other problem, because then you're going to be liable for having hurt them.
yeah,
You made them transgender, or you told them to come out to their family when in fact that wasn't the issue, right? Like, so the medical professionals were taught to be very careful. They were told you will be liable if you hurt your client, and so you have to
yeah,
be absolutely sure that this person actually is transgender when they say they're transgender. So what they did was they made these frameworks to
okay.
say there is a mental illness called being a transsexual. And it was
Hmm.
written up in the book, and they had to make all the criteria because they did it according to the medical style. And they'll say, if you meet a number of these criteria, then we will diagnose you as actually being transsexual. And that covers our liability for then treating you according to the thing we have diagnosed you with, right? But just because that's the system doesn't mean that being transgender actually is a mental illness. And they actually, in the past several years, have updated those medical guidance literatures to
Uh,
say, no, not really. Yeah.
yeah, I need to interrupt you and thank you for, like talking about it. I'm also interested in knowing the people who set up these systems. Were any of them trans at the moment?
That is interesting. And to my knowledge, no, they were not.
Because I see so I talked with Anang Shah, like I guess 2 weeks ago. We had this kind of interview only, and like we discussed feminism, and a lot of issues with feminism is the people who are setting up the rules or criteria for feminism are men, or like who are like totally privileged, and all that kind of stuff. So every time I hear someone saying that we are setting up something, the very first question in my mind comes up is, do they have a person who is actually related to that stuff? So for example, in India, our ministers are usually not well educated, which kinds of like makes you question that the person who is setting educational guidelines for the country, if they are not educated, how is the system going to be fair or just? Interesting. And
Interesting.
I'm just kind of like, I'm so glad that I'm doing this interview with you, because I got to learn so many things already.
we, we are
and
learning things about our world. Yeah.
and
Um,
it's actually interesting to understand, and I did not know this about that it was considered as an illness, or is it still being considered as an illness?
Not so much anymore, no. In the past
Okay.
several years, it's being described more as a condition, which, in my understanding, means something more like a situation that you deal with, but
Okay.
not something that is a defect that has to be corrected.
Okay.
So it's more like, because it's a condition, it's something that a medical professional or a psychotherapist can help you adapt to. It can be discussed more as the circumstances of your life or your body or your mind body interaction,
Yeah.
but
Yeah.
not so much what we call pathologized, not so much as something that is
Hmm.
wrong with you that needs to
Yeah.
be corrected.
So educate me a little bit on this. Like, do you think, is it fair whatever the situation is now, the way you mentioned it, or is there still some like fallacy or false interpretations that needs to be changed?
As far as transgender people getting medical care and psychotherapy,
Okay.
I think that a lot of people can't afford it, first of all.
Yeah. Yeah.
A lot of people would benefit from psychotherapy and need surgery, actually. I would say need to feel confident about themselves, to
Hmm.
like their body enough to be able to function in the world, and also to keep themselves safe if they're living as a member of that gender. They need to be able to walk down the street safely. And
Yeah.
if
Yeah.
hormones and surgery will help keep them safe in their gender, then that's a reasonable request. Um, and it's therefore an injustice that some people can't afford it. That some people's privilege allows them
Yeah.
to say to design the way they want to look,
Yeah.
to um, to take care of their bodies and take care of their minds, and to live in safe neighborhoods, for example. That's kind
Yes.
of that's an underlying situation that affects our healthcare. Are we
Yeah.
living somewhere where we are not at risk for getting hit? Um, all of that is part of taking care of ourselves.
Uh,
So yeah, being able to afford it and having access to competent health professionals, yeah, is another part of it, that a lot of healthcare professionals still don't know anything about it, so they're not able to provide the competent healthcare even if the person can afford it.
so I would want to share a little bit, and point out what you mentioned, that some people need surgery to feel confident. So I
Mhm.
worked with, in my previous company, we had a client, plastic surgeon client. Okay. I come from a marketing background. So understanding their product is, like a prerequisite to my job, like why they are doing what they're doing. And we have these misconceptions that like breast in enhancement or breast reduction or lip surgery or doing something with your face and stuff like that, those people are really superficial, to label them, let's say. I don't know if you think it this way, or people from developed countries think this way, but in general a lot of people do like stereotype this, like having a
Mhm.
plastic surgery, and not a plastic surgery to live. Like you are not going to die if you let's say uh, don't change your face, if you don't going to, if you're not going to die if you don't reduce, or like manipulate, not manipulate, but if you don't, what's the right word to use, do something about your lips, let's say, you're not going to
Mhm.
die per se. But I believe like we have come to a world where survival is not the only point of concern,
Right.
and confidence is like underconfident people also survive, but we need a little more than survival. And when I researched a lot about like plastic surgeons, and not the kind of plastic surgery that comes for burn victims, let's say, where you need plastic surgery.
Mhm.
I'm talking about the plastic surgery in beauty stuff, okay, where it's a choice of a person to feel confident, to feel beautiful. And I saw some testimonials where like let's say a teenage girl, maybe 17, 18 or 19, she got breast enhancement surgery, and it helped her gain confidence like multiple folds. So I totally like endorse your statement that sometimes you need surgery, and for other peoples it might not look as a need, but maybe for you it is not just a desire, it is actually a need.
Yeah. I think it is very personal and it can be hard to explain because it
Yes.
comes from the context of our lives, all of our associations with what is gender and what gender am I.
Yeah.
It's very deep rooted. And I was interested that you brought up the example of a burn victim
Yeah.
because if I burn my skin, it's a medical problem. Our skin protects us, right, from the outside world,
Yeah.
and we will be prone to
Yeah.
infections if we don't have good skin. And it's also very painful when there's a problem with our skin. It's a very sensitive organ. Um, so we do need to fix that if the skin is severely damaged
Yes.
medically. But then there's also the situation where someone simply has a very bad scar from a burn, for example, or some kind of a cut. And sometimes when people have those kinds of injuries and they're left with very bad scars, they they want to correct them for psychological reasons. They have
Yes.
a psychological problem. They say, okay, well, I was burned on my face. It's not damaged anymore. It no longer hurts. It's no longer infected, but I can see it. And and this makes me socially isolated. For example,
Yeah.
if I'm so embarrassed about having a scar on my face that I don't leave the house, that is severely impacting my life. That means I don't have a job. It means I can't take care of my family. So I need someone to fix what I
Yeah.
see as a defect in my face, and then it will dramatically improve my life, right? If I'm at least given a chance to correct that scar to the best of my ability. And there might be someone else who has exactly the same sort of scar, who is
Yeah.
not psychologically bothered by it. They say, whatever, I
Yes.
have a scar on my face, I go out, I have my job, I have relationships, not a big deal. It's so personal, it's so individual.
Yes.